Good afternoon. My name is Andy Kaiser. I'm the Physician-in-Chief of Cardiovascular Services at St. Clair Health. On behalf of the Pittsburgh Heart Team Summit Program Committee and the Career Development Committee of the Eastern Cardiothoracic Surgical Society, I'd like to welcome you to our left field chat here in the left field of PNC Park in Pittsburgh, Pennsylvania. It's a pleasure to be here today. This program is done in collaboration with the Eastern Cardiothoracic Surgical Society, and we've asked Dr. Michael Mack and Dr. Blaise Carabello to join us in the discussion about mentorship and career development. There's no way I could appropriately introduce either one of these gentlemen other than to say they're probably two of the most influential physicians in cardiovascular medicine today. They've mentored many people across their careers, and they've also been a significant mentor to me. And I consider them dear friends, and it's really my honor to have them here with me today in Pittsburgh. We're going to have a discussion today about mentorship and career development. And I'm going to start just by some questions for both of you. I'll start with Dr. Carabello. Just tell us your story. Where'd you grow up? What made you choose your career path, and maybe even some of the mentors along the way that influenced you?
Well, thank you for the kind introduction. I was born August the 5th, 1947, and within an hour or so I met my first mentor, otherwise known as my father, who is a solo practitioner of pediatrics. And as my life evolved, I recognized the total crap of work-life balance, because there was none. He often was in the hospital before I got up in the morning and came home after I went to bed. He never came to any of my ball games or was not very involved in my life. And there was no man that I ever loved more or respected more than I loved my father. He taught me the importance of both compassion and dedication to his job. And I don't know what the secret sauce was. I don't know how he imparted that to me, but all I can say is it worked. And certainly he was somebody that I looked up to and wanted to be like for the rest of my life. I grew up in Reading, Pennsylvania, which at the time was a manufacturing city. Almost all of that's disappeared now. And then went to Gettysburg College, which after a beer-inflicted time on academic probation, I got my act together. My GPA my first 2 years was 1.8, and of the second 2 years was 3.9, and was able to convince Temple University to accept me to their medical school. And after sitting in lecture hall for the first year in April, we had the section on cardiovascular disease. And one of the lecturers, who was the newly minted chief of cardiology, there, a guy named Jim Spann, made more sense to me than anybody I'd heard in the last 8 months. And that kind of got me, because he was able to model the cardiac system as a pump or as an electrical circuit. And then that summer I had the opportunity to work in his laboratory. And that was kind of it. That put me on the path of cardiovascular disease, and he was an important figure in my cardiovascular pathway for the rest of my life, because after Temple I came back there on faculty with Jim, went to South Carolina with Jim, and he was clearly important. But from Temple, I spent 6 years in Boston at the Mass General, where I did my medical residency, and was then the Peter Bent Brigham Hospital in cardiology. And at MGH, two clinicians, senior clinician Roman DeSanctis, who impacted so many people with his graciousness and brilliance, and my first chief resident, a guy named George Thibault. The two of them really taught me the path of good clinical physician, that I always wanted to be like that. And then at the Brigham, I met up with Bill Grossman, who maybe was the most important mentor in terms of my academic career. He taught me the importance of getting the job done in a fair and even way. Cautioned against being so cautious that nothing ever got published, but being too loose that you would make a mistake. And he remains one of the closest friends I have today, and a very important mentor. And then from there, I went to UVA, where I met up with George Beller. He was important because he had just gotten to UVA, essentially brought there because they recognized he would be a pioneer in nuclear medicine. But he never held an administrative position before. So it was kind of interesting watching how, because I never had either at one point in my life. So watching him handle that was also important. But those are the names of the people, you can say. But throughout one's life, you meet so many people that add a little bit here or subtract a little there that impacts your character of what you do. But I don't think many people can invent excellence. You learn excellence from the people that surround you, most importantly your mentors.
Well, you've remembered many of your mentors along the way. Certainly they made an impact. Dr. Mack, the same question. Tell us about how you got started, what directed you into the career path you chose, and about some of your mentors.
So, first of all, Andy, thank you for having me here to Pittsburgh, and I think it's appropriate we're having this chat in left field here, because a lot of people feel throughout my career that's where I came from, was out of left field. So it's totally an appropriate setting for it. Secondly, I've learned something here already, that my close friend Dr. Carabello here is my senior colleague, Dr. Carabello.
Oh, I gave you my age.
Yeah, he's 3 months older than I am. So November 24th, 1947.
Well, Sonny, it's okay.
But which brings up another interesting story. I grew up in another northeastern industrial city, Syracuse, New York.
Yes.
And there is an Italian cardiac surgeon named Antonio Calafiore, who was born November 24th, 1947 in Syracuse, Sicily, the exact same date that I was born in Syracuse, New York, and we both became cardiac surgeons.
Isn't that something?
Yeah. So that total serendipity.
That's wild.
Yeah. So, I would say, a couple things. I'm the first physician in my family. I didn't have anybody in my family as a mentor or an example. My father was an accountant, and my mother was a stay-at-home mom. And I've got a younger brother and a younger sister. And I'm the only person that ever left Syracuse. Everybody else is still there. And I left for training in Boston and kept moving farther away. My mom kept hoping I'd move closer, but I never made it back to Syracuse. I went to an all-boys Catholic high school, and graduating from high school, you had three choices where to go: Boston College, Georgetown, or Notre Dame. I ended up going to Boston College, and to this day, my favorite team is whoever's playing Notre Dame that week. And I got into pre-med as a major because I had to pick a major, and I had no idea what I wanted to do. And pre-med sounded good, and there was nothing more compelling than that, getting into it. So from there, I went St. Louis, Minneapolis, Dallas. My last surgery training was in Dallas, and I ended up staying. In terms of what influenced me to go into cardiac surgery, I'm not 100% sure. At the time, my initial training was internal medicine, and at the time, cardiology was a diagnostic specialty only. There was no such thing as interventional cardiology. And I couldn't even begin to read an M-mode echo. So I said, cardiology is not for me. So I went into surgery, and once I got into general surgery, I had the experience of cardiac surgery. It also was the time, when I was in college in the late 60s, when Cooley and DeBakey were on the cover of Time magazine and Life magazine, and cardiac surgeons were bigger than life, and maybe I want to be one of them when I grow up. But I would also say that one of the lessons that I learned early on is surround yourself with good people and stand back and stay out of your way, and they make you look good. So in terms of mentorship and that, It's never be shy about surrounding yourself with somebody better than you.
Yes.
Because at the end of the day, it only helps you.
Well, you both have led impactful careers across both medicine and surgery. You've written guidelines, you've been influential in some of the big studies that really direct what we do today. What are you excited about right now? In other words, if you could start over today and do it all over again, knowing what you know, what would excite you about today? Dr. Mack.
Well, so I guess the first thought on that is that there's two ways you know you're getting old. The first is when they ask you to talk about the history of something.
Yeah.
And then the second is when you get asked, what are your do-overs? Or if you had to do it again, what will you do? So I think both of us are getting old because we're getting asked that question, Blaze. And so my first and easy answer is that I wouldn't do anything different. I'm glad I did what I did. I wouldn't change anything about that. If I had to do it all over again, I'd do the exact same thing over again. Now, obviously, I've learned a lot along the way, and there's a lot of nuances, things that I would do different from that standpoint. But I think this is, an incredibly exciting field. If I just think of something simple as TAVR, if you told me at the beginning of my career that you could put an aortic valve in place through a needle in the groin without opening the chest, I would have said, you're crazy. This is Buck Rogers Star Wars stuff.
Yeah.
And so, who knows what the next 40 years is going to be, because that's something I never would have predicted. The other thing is when I look back and when I graduated from medical school and first started in surgery, 90% of the operations today are totally different than what was done at the beginning of my career, which is another way of saying I'm real old.
Dr. Carabello.
Well, I think the most exciting thing in the future is biology. We're looking at the end of disease, not the beginning. And Mike and I were talking about this earlier. When we were residents, there were about 8 drugs that you used to treat cancer with, and you hoped that they would kill the cancer right before they killed the patient. Now you can't open a journal without a new MIB or a MAB that specifically targets a gene product that the cancer cell is making, that allows you to interact with the cancer in a much more targeted, direct way. Likewise, in cardiology, we really don't have a unifying hypothesis or understanding of atherosclerosis. Sure, we know the risk factors, and obviously lipids are involved, but there are people that have none of the risk factors and have terrible disease, and have all of the risk factors and don't have any disease. And so we need to learn more, and I think, though, there will be pharmacologic targets along that pathway that's developed over the next 40 years. As Mike says, when I was a fellow, EP was simply putting in a single chamber pacemaker. That's what there was. Yeah. There were no ACE inhibitors or ARBs or ARNIs. There were no coronary stents that had just, Brunswick had just done that for the first time in about, I guess, 77. There was all of the stuff that are routine today weren't even thought of then. And as Mike points out, what will the guys that just presented today, what will those residents and fellows that presented their research today be doing in 2060?
Well, you both have been talking a lot about medicine and clinical sort of aspects of your career. I want to change gears just a little bit and use your retrospective scope at your wisely stature and think about what was it that made you such good mentors. You've accomplished a lot from a clinical standpoint, but you've also trained a number of residents and influenced a number of faculty along the way. What was it that you think was an important character of you as a mentor?
Well, first of all, you've got to pick the right mentoree. If you can't mentor a dud, you can't mentor someone that's not interested in being mentored. But for the person who comes and says, I would really like to do this, I think the first thing is understanding what their dedication is. If they think they're going to get this done during working hours, from 9 to 5, you can say, listen, either re-educate them or tell them, don't waste your time, because it isn't like that. There has to be, most research gets done on your time. You have, most of us, certainly Mike and I, are clinicians, and you discharge your clinical responsibilities first. You do the research part of this on your own time, and that takes a dedication to
Right.
this. But then I think the next more, certainly Bill Grossman taught me, accountability. You can't just say, well, here's an idea, go mess with this. You've got to set up a series of expectations, regularly schedule meetings for that person to come and tell you what they've accomplished, and make sure they are moving on a track to getting it done.
Right.
Otherwise, it'll be just some neat idea that you had that they never finished.
Active involvement.
Active involvement. Then, once they do it, once they get their first paper or their first abstract, that virus tends to keep replicating. You know, they get infected with that. They think, this was really cool. I think I'd like to do more of it, or sometimes not. But I think you have to mentor folks that this is not easy. Expect that it's not easy. Hope that you have a family that understands that it's not easy, and then demand accountability.
Dr. Mack.
So I agree with Blaze. I think to some degree it's managing expectations of getting to know that individual and what is meaningful for them. Not everybody wants to go in academics, and try to put a square peg in a round hole just doesn't work.
Right.
So you need to understand what's important to them, and you need to encourage them to find what their passion is. And they have to find it themselves, although you can give them guideposts and ways to do it. A number of years ago, I was giving a named lecture in Montreal, and the daughter of the named person was sitting next to me at dinner, and I asked her what she did, and she said, I'm an executive coach. And I go, what's an executive coach? Well, we coach Fortune 500 CEOs how to relate to their job, their press, everybody in their world. And I go, really? These guys just weren't born with this expertise of how to be a CEO? I said, no, they're all coached. So, one thing that I wished I had done sooner was gone through leadership training or got an executive coach. And it helps you think you know how to relate to people and that, but everybody needs coaching in every aspect of their life to some degree. And I think that's been something that's been very beneficial to me. I'm not as nice a guy as I thought I was,
Probably good, but I think the one thing that I would have added or would have liked to have added would be a master's in hospital administration, both the business aspects as well as the personnel management, because I find that people with that degree are really very, especially put in positions of clinical leadership, are extremely potent.
Right.
They're very effective in what they do because they know that stuff.
Right. So you've alluded a little bit to this. I think there's a bit of a difference between mentorship and career development, and you were talking about the difference in academic and private practice. There are a lot of people who are watching this live webcast, and we're going to record it, and there will be people who come back and watch it again, and they're looking for some guidance. Young physicians like we had in our summit today who are doing, just getting out of their training, who are looking for advice. Trainees who just finished and young physicians who are just starting their practice, looking to how to develop their career. What advice would you give, not just them individually, but our societies as we engage in some type of coaching or leadership development?
Well, I would say what I began to allude to before. Figure out as early as you can what your passion is, and then gather all the tools to be able to follow that. And, I agree with Blaze that, one thing I wish I had different was more of a business background. Mm-hmm. I think as much as all of us just want to go into work every day, see a patient, take care of a patient, operate on a patient, healthcare is a business. Yep. And we as physicians are naive when it comes to business. Yeah. And everybody else is in the business of healthcare now. And now we've got Amazon and Walmart and CVS and private equity all invested in healthcare, and whether it's in healthcare administration or something. An MBA or something would have served me a lot better. So, you know, it doesn't matter whether you're in private practice, ended up being the managing partner of a private practice group, or having some role in hospital administration. It's naive. We're naive as physicians of not having better understanding of business.
And if we had understood it 2 decades ago, we might be in a better position today. Instead of following, we could have been leading the best practice of medicine with regard to the finances of medicine. But I would probably counsel society to get off its ass and start. This is hard. You can't be, medicine. If you want an easy life, don't pick medicine. This is hard. It takes most of it's just hard work. It isn't brilliance. I think the average physician's pretty bright, but we're not geniuses. This is hard work. And you've got to be prepared to do that. If you're not prepared for hard work, I don't think you should be doing this.
That makes sense. So what do you find rewarding? And not in what you've accomplished, but in the people that you've worked with. A little bit off of the script, but there are certain, you mentioned mentees and picking mentees and picking, the ones that really wanted to be engaged. Are there certain characteristics that you look for in someone that you find, would be a good mentee? And, what do you find rewarding when you work with them? Is it their abstract? Is it the relationships you have?
Well, I think it's the first move. If they come to you and say, I'm really interested in this. I mean, sometimes the residents do it just because they think you're going to help them get a fellowship. That doesn't count.
Right.
But a fellow that comes to you and says, I would really like to pursue an academic career. Can you help me?
Right.
You already got a winner. I mean, they've made it as far as a fellow. They must be pretty bright and have pretty good skill set, and they've just said it's what they want to do. So, it's up to you not to screw it up and help them along. Because I think that unless the first step has to come from the mentee, not from you. I think it has to be a desire to get it done, and then from then it should flow pretty smoothly.
So I totally agree with my senior colleague here that that there has to be an openness to do it, and secondly, there has to be a level of energy or a level of enthusiasm. There has to be a willingness to go the extra mile, and then you have to have the ability to accept criticism. It's also incumbent on us to give criticism the right way and be sure that it's constructive, but have it be a flexible enough of mind that that individual is able to say, oh yeah, I see it now, I got it, and is willing to change course.
Yeah. You mentioned it's hard to be a physician, it's hard work. What's the upside to being a physician? I mean, you've been physicians for, how long since you finished medical school?
So I graduated from medical school, let's see, if I could remember, just kidding. No, I graduated from college in 1969 and medical school in 73.
Exactly, May 29th, 1973. So this coming May, for both of us, we'll have been physicians for 50 years.
50 years.
And I'll speak for my younger colleague here, that our brains are still larger than our prostates.
Maybe. Excuse me, I got to go to the restroom right now.
We've aged gracefully.
Yeah, but you've, like I said, you've accomplished a lot. But what is it that excites you about having been a physician? I guess what did you find rewarding in your career? Not necessarily the clinical part. What is it that you really found value in?
For me, it's the personal relationships. It's coming here and seeing you two, or going to another meeting and being approached by a former fellow that's now in practice and wants to talk about old times, or it tells you what they've been doing. The privilege of those relationships as the years go by, because so much of what we'll do is important now. It'll be forgotten in 10 years or sooner. But the relationships last as long as you and the person with whom you got the relationship on earth.
Yeah.
And I think that's That's to me the most rewarding part of the deal.
I would say, I would say two things. First and foremost, the fact that somebody has entrusted their life or their loved one's life to your care. I mean, that is pretty special and should never be forgotten. And I can't think of anything more meaningful or impactful to do with a life, and that is to be cherished. The second is every day is different. You walk in to work in the morning, and you never know what your day is going to bring. Yeah. And so it's the variability and the diversity. It's not like going in, not there's anything wrong with going in and sitting at a desk and turning on your computer every day, but going in, seeing a patient, doing an operation, every day is different. You never know when the aortic dissection is going to come in, or
how do you the expression a routine operation? I'm sure that just makes you both of you cringe.
Yeah.
What is that? There's no such thing, right?
Right.
Yeah.
Everything's different. Every operation's different.
But I agree. Certainly the patients that meet you on the street and say, "You probably don't remember me, but," and then that's very special.
Yeah, and they meet you and you say, "You took care of me 20 years ago. Surely you remember, don't you?" And they don't tell you their name.
Well, we had this session again, and it's a joint session between the Eastern Cardiothoracic Surgical Society, the Career Development Committee there, and the Pittsburgh Heart Team Summit. This is the fourth year we've had this summit, and the whole premise of the summit is to bring people together from different institutions and collaborate. And this is what this discussion has been about. Is not just the collaboration between you two, but a discussion about what you've accomplished and how you can encourage other people to do the same thing. This has been a great discussion, of course, and I really appreciate both of you being so genuine with your responses. What would you close with, Blaze? I mean, what impactful statement would you say after 60 or 50?
50, almost 50.
Sorry, after 50 years in medicine, what impactful statement would you leave to people who are looking at this as a career or are coming to the same?
Well, I would say simply to those, look in the mirror and decide what it is you want. Where's your passion? What is the thing that you really love? And irrespective of what that is or what the compensation for that is monetarily, go do that. And learn to do it well. Become excellent at that. There are some people that can become excellent at many things. I wasn't one of them. But I think that take a field and run with it. Become, just immerse yourself in that and go do it to the best of your ability. And look forward to doing it every day. And you'll always look forward to the next day.
Great advice.
So there's a couple thoughts that come to mind. Never be sure that what you know is what you think you know is what is really true. Now I realize that's a politically fraught statement right now,
Right.
saying that, but what I mean is, so the CTSN network, which is an NIH network of surgery trials, Irv Krohn and I were speaking a year or two ago. And of all the randomized trials that have been done in cardiac surgery, not once have we predicted the outcome of that trial correctly. Everything we thought we knew, we got wrong.
Yeah, which is why we do trials.
Which is repair versus replacement for secondary MR, and rate control versus rhythm control for post-op. Anyway, that's first. Second is the field of structural heart disease is very timely and topical right now, and this is the 20th anniversary of TAVR, and say what a difference that's made, and all that is true. But I think the bigger legacy that's come out of all this is the heart team and the partnership.
Yes.
I think that the turf battles have gone away. To a large degree, and especially in the institutions that have embraced the heart team concept. You're doing this with this meeting, and the programs that are most successful are programs that do have a functional heart team and it's not just a checkbox.
Right.
And so, you know, what I would encourage you to say is, you know, if you're a cardiologist, you know, make your local surgeon your newest best friend. And the same thing from a surgery standpoint. You doesn't have to be an interventional cardiologist. It could even be an imaging cardiologist or a general cardiologist. But you know, and go to meetings together. I mean, go to a Pittsburgh Pirates baseball game together.
Yeah.
You know, that type of thing. Go to meetings together, and the camaraderie that comes from that. You just look forward to going to work every day with those individuals.
And understand that the disciplines have different skill sets. Mike and I were talking about this earlier. The surgeon's understanding of anatomy so far eclipses almost any cardiologist's understanding of cardiac anatomy. I mean, what you gain by having that skill set, that knowledge on hand, when you discuss what to do with a valve, is just puts the patient years ahead of the game. And I think that's, in terms of the heart team, it really is a situation where the whole really does become greater than the sum of its parts. And that's the idea.
Yeah. Well, on behalf of the Heart Team Summit and on behalf of the Eastern Cardiothoracic Surgery Society, but more importantly, on behalf of all the patients you've impacted, not just the ones you take care of, but by being such tremendous leaders in surgery and in medicine, and also the people that you mentored along the way. People like me who've gained a tremendous benefit by just knowing you and having the experience to be in the same meeting with you and learn from you, but also your friendship. So thank you so much for joining us here today and for being so genuine with your comments and really making great statements about how we can become better mentors, mentees, and also help with career development.
Well,
thank you so much.
Yeah.
Thank you for having us, Andy and
Great.
Blaze. I think you will agree, both of us are legends in our own mind.
Absolutely.
Right, well, thank you.
Thank you.
Thank you.